Okay, so we're going to look at the flow of blood through the heart again, and I'm also going to post this video on Edmodo so that you're able to access it whenever you would like. One thing we haven't talked about yet is the fact that there are actually two circuits for the cardiovascular system. The systemic circuit is a circuit in which the blood is able to move to and from the body, the oxygenated and deoxygenated blood. And there is the pulmonary circuit in which the blood is actually being moved in and out of the lungs to become oxygenated and then send back to the heart so that it can go out to the rest of the body. Another thing we haven't said too much about is the fact that the heart, obviously contracts and relaxes and contracts and relaxes. It is during the relaxation period, the heart muscles are relaxed, in which the atria fill up. This is called diastole period. And then during the diastole period, both of the heart muscles relax, the atria fill up with blood, and then just as the start of the systole period begins, that's when both of the atria are contracting, flooding the blood through the valves into the ventricles. Now, when it's in the ventricles, it's not pushing up, during that contraction, it's not pushing up into the pulmonary artery or the aortic artery just yet. A few seconds later, after the blood pulls into the ventricles, that's when we have another contraction which forces the blood up through the pulmonary trunk, back out to the lungs, or up through the aortic arch. Of course, we mentioned earlier today, or yesterday, that valves have a particular purpose. And that particular purpose is to keep backward flow of blood from occurring. We don't want to have any regurgitation of blood. Okay, so here we are actually looking at the heart, and you know that oxygen poor, or other words, deoxygenated blood, that is actually carbon dioxide rich, is going to enter via the inferior or superior vena cava. The blood will then pool within the right atrium. The right atrium will start to fill up. Once the heart muscles contract, the blood is going to be forced through the tricuspid valve. Remember, I said you're going to have to try it before you buy it. So then the blood will pool again here in the right ventricle. The heart will contract once more, forcing blood up through the pulmonary semilunar valves, through the pulmonary trunk, and then it will go ahead and exit the heart, heading toward the lungs to go pick up some oxygen via the pulmonary arteries. Remember, arteries carry blood away. The pulmonary ones are the ones that are different in color. We pick up the oxygen that's necessary, and it also helps to alleviate some of the carbon dioxide that has been built up. And now the blood from the lungs is going to return to the heart. So it's oxygenated blood returning via the pulmonary veins, because the veins love the heart. So the blood's going to come back in. We'll pool here in the left atrium. The heart will contract once more, forcing the blood to go through the mitral valve, which is also known as the bicuspid valve. Same story as I mentioned before. Remember, you have to try it before you buy it. Okay, so now you've gone through the bicuspid valve. The blood is now pooling here in the left ventricle. Heart will contract once more, pushing the blood up through the, right here, aortic semilunar valves, carrying the blood through the aortic arch, which will allow the blood to either exit superiorly or go on ahead and continue down and exit inferiorly. Make sure you know the names of the hearts, the structures of the heart, and the flow of blood. Good luck. Bye.